Hey guys, Alex Winder here from Blue Wave Insurance. Today we're going to talk about the different parts of Medicare, what they cover, and also the Medicare plan options that can go with Medicare. So first we're going to take a look at the different parts of Medicare. There are 4 parts of Medicare: parts A, B, C, and D. Now, parts A and B are the parts that are administered by Medicare and make up original Medicare. Parts A and B. So part A is your hospital insurance and part B is your medical or doctor insurance. Those together make up original Medicare. Then you have part C, which actually just refers to Medicare Advantage plans, which is an optional plan to go with your Medicare. We'll talk about that plan. And then a part D drug plan, which is an option as well. But first, let's focus on parts A and B that make up original Medicare. So part A, also referred to as hospital insurance, is going to cover you in a facility like a hospital, skilled nursing facility, mental health facility, and hospice. So for part A, think facility care. As far as the costs go, part A is generally free if you've worked for 10 years and paid into the Medicare system through your taxes. So when you turn 65, or if you're going on to Medicare a little bit later, when you start part A, it should be premium free if you've worked those 10 years. And then part B, which is going to cover you at a doctor's office, outpatient facility, it'll cover your durable medical equipment, cover you at lab services, blood work, MRIs, x-rays. Part B is going to cover you for most of the stuff that you get done. So your day-to-day stuff, that is part B. That is $185 per month in 2025. Now that $185 can go up based on your income. Be sure to check out my video regarding the costs around Medicare Part A and B. And particularly, I go over the Part A IRMA costs, where the government will look back 2 years and charge you more based on your income on your Part B and the Part D side. So that's part A and B. Again, this is original Medicare, A and B. Now, your plan options. So this graphic makes it I think it makes it pretty easy to understand. So a lot of times folks either overcomplicate the options, or it just someone explains it to them and it doesn't make any sense. So here are the options. You have original Medicare, which is, we just talked about, A and B on one side. So if you start Medicare, you decide you want to keep your original Medicare, A and B, most people add on a Medigap plan or Medicare Supplement plan. We'll talk about that in a little bit. And then a Part D drug plan to cover prescriptions. That's one option. The other option is a Medicare Advantage plan, which takes over your Medicare. You can think of it as replacing your Medicare because it takes over, becomes primary, combines everything together into one plan. It's administered by a private insurance company like Humana, Aetna, United Healthcare, or somebody else. It comes in the form of an HMO or PPO plan, includes drugs, usually includes dental, vision, hearing. So, and it has a network component, HMO or PPO. So those are your options. You either do an Advantage plan, which takes over Medicare, or you stick with the original Medicare and do a supplement and drug plan. We'll dive into these 2 options so you can better understand them. So keeping original Medicare as your primary, you would add a Medigap plan. Now, the advantage of going this route is there's no networks. You can go to any doctor in the country that takes Medicare. No referrals. Most of these plans offer international coverage for emergencies. You do need to have a separate drug plan. But essentially, this option gives you the most freedom because, again, you can go to any doctor that takes Medicare anywhere in the country. Gives you the best coverage, but it does have a premium attached to it, usually in that $100 or more range for a plan. We're going to dive into the different plan options, but it kind of gives you a gauge. Now, that 100 can be more if you live in New York or you live in California, or Florida. Some states are more expensive than others, but on average, a Medigap plan is going to be around $100 per month for $100 per month for a 65-year-old. If you're older, that can go up. Now, you may have seen this chart floating around the internet. It shows all the Medigap plans available. We're just going to talk about 2 of them, the 2 most popular ones, Plan G and Plan N. Now, there is a high deductible version of Plan G in 2025. The deductible is $2,870 for the year, $2,870. So that's an option too, but we're mainly just going to talk about G and N as they're the most popular plans. So breaking it down, Plan G is one option, Plan N is another option. Plan G is very straightforward. No copay, a flat deductible of $257 in 2025. That's associated with doctor visits and outpatient services. So January, you go to the doctor, you get blood work done, you have an MRI done, you'll meet that $257. After that, full coverage for everything that is Medicare approved for the year. That is the most popular option because it's the most comprehensive for people new to Medicare. Plan N, very similar to Plan G, except it has a copay, $0 to $20 at an office visit, $50 at the emergency room, waived if you're admitted. Same deductible as G at doctors and outpatient facility, $257 in 2025. And then one other item not covered is Part B excess charges. These charges are very, very rare. There are a handful of states that don't allow them, but they only occur if you go somewhere that doesn't take Medicare assignment, meaning they have not agreed to Medicare's billing terms. In that case, they are allowed to overcharge Medicare approved amount 15% on the Part B side. So it is possible, but rare on Plan N. So G or N, I'm going to pop back to this slide here to give you another overview. What we just talked about. Medicare, original Medicare is your primary. Medigap plan, G or N. The other side, Advantage. Medicare Advantage is the other option. You cannot have a Medigap and an Advantage, so it's one or the other. An Advantage plan. Now, these plans usually come with a 0 monthly premium. You still have to pay your Part B premium, but the Advantage plan itself is usually $0 per month. It can be more. Combines A and B into one plan, takes over your Medicare, and becomes primary. So you're no longer using your Medicare card at the doctor, you're using your Advantage card. Now, it does have an out-of-pocket. It has out-of-pockets versus the supplement plan that has very little out-of-pockets. The Advantage plan can have very high out-of-pockets, anywhere from a couple $1,000s up to $7,000, depending on the plan that you're on. So for our clients, we usually recommend adding a secondary hospital plan with a cancer rider that can help protect against those out-of-pockets. Now, these plans are kind of similar to your individual health plan or your employer plan that has a network component, an HMO or PPO, has co-payments, has co-insurance, has deductibles. So the disadvantage is going to be those out-of-pockets in the network component. The advantage is the low monthly premium and the fact that it does include drug coverage and usually includes decent dental, vision, and hearing benefits as well. So there are some advantages and there are some disadvantages with the Advantage plan. So to recap, your plan options: original Medicare with a supplement or Medicare Advantage. A Medicare Supplement plan lets you go to any doctor you want that takes Medicare, no referrals, essentially the best coverage possible with a premium attached to it, usually about $100 a month in addition to your Part B premium. Does not include dental, does not include drug coverage. That's purchased separately. So that's Medicare Supplement or Medigap. The Advantage option takes over Medicare. Think of it as a pay-as-you-go. So if you're paying $0 for the plan, you're usually going to pay something at the doctor, at the hospital. It includes the dental, vision. Usually includes dental, vision. Almost always includes drug coverage. Premiums are usually in the $0 range in addition to your Part B. So that kind of breaks it down. Hopefully that allows you to understand it a little bit better. So if you're deciding which plan should I choose, I can offer a little bit of advice. So if you're new to Medicare and you can afford the Medigap plan and the drug plan, it's in your budget, I would go that route to start because it's going to give you the most coverage. And in addition, when you're new to Medicare, you can get a Medicare Supplement plan without any health questions. If you wait later on, you can be subject to health underwriting depending on where you live. So you may not be able to get a supplement plan. So if you're on the fence and you can afford a supplement, do the supplement to start. You can always move to an Advantage in the future because there's no health underwriting going from supplement to Advantage. But if you go Advantage to supplement, there can be health underwriting. Now, there are some situations to bypass that, but without getting too far into the weeds, again, on the fence, you can afford a supplement, go that route. If it's not in your budget, you don't care, you just want something affordable, then the Advantage plan can be a great option as well. If you need any assistance, if you have any questions, need help, free quotes, plan comparisons, give us a call, 877-318-0747. We'll be glad to help. Don't forget to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video. See you on the next one. Thank you.